On-the-scene coverage of ACC.14 is supported by Janssen Pharmaceuticals, Incorporated.
I'm Peter Block at ACC at the annual meeting in Washington, D.C., and the late-breaking clinical trials once again become very interesting. The whole business of Bivalirudin versus heparin bubbles up, and with me is Carlo Berguri from Italy. Carlo, you've done a study specifically on elective patients, not acute coronary syndrome patients, where maybe Bivalirudin is better. These are elective cath patients, Bivalirudin versus heparin. What'd you find?
We found that in elective patients with high risk of bleeding, this is an important message, high risk of bleeding according to the clinical characteristics, in which the procedure is performed through the femoral approach, we didn't find any difference in the rate of major bleeding between the unfractionated heparin and Bivalirudin.
Absolutely none, even if the heparin was out of control. What about the ACT control of the heparin patients?
This is an important aspect. We utilize the recommended dose of heparin in order to have ACT level of 250, 300 at the most. So if you utilize this dose of heparin, low recommended dose, the risk of having major bleeding, even in this high-risk population, is very low.
And let me ask you something about perhaps the longer-term follow-up, which you may or may not have any data on. Is there any difference going out further than immediately in terms of not just bleeding but other factors?
Yeah. This is an important aspect. We had also the 1 month and 1 year follow-up of this patient population, because one problem is that the risk of stent thrombosis seems to be a little bit higher in Bivalirudin. We didn't find any difference according to death, acute MI, stent thrombosis, revascularization, no difference at all.
So let me just emphasize what you've told me to make sure I get this. These are elective, high risk for bleeding patients, and yet given heparin with an ACT of somewhere around 250 to 300, no difference in bleeding, and long-term not very much difference either between Bival and heparin. So is the recommendation give the cheaper drug, or what would you say?
Yeah, of course, Bivalirudin is very expensive, so the recommendation is to utilize heparin at the recommended dose and test ACT in order to have a lower risk of a complication.
All right, so the take-home message for me is if I have an elective patient, I guess I'm going to give him heparin instead of Bival, and as long as the ACT is under good control, I should be okay. Fair enough?
I believe so.
Thank you, Carlo.
Thank you.